Good afternoon, everybody. This is your President Jonathan Nez, and we're doing a town hall type of event here so that we can get information out to the Navajo public. So yate danihidi nido le tsagaho zande aro pa kniya sasi kliido jukdoi hanegi nikeni ne which kodadi niltadi no jota la undaido kit halaho edo haila bane kaile tsagaho zanne da no da jo kunchi banda huilnende banda huilnende kodo nikeni ne asta do spend hazenda sashi havanda daso kai here education ne kodo ina ani kodo ken so zondo daisno tsagi here na kwa shkido shne so kunso shi ya kodo yat en hidini do le ya ni President Jonathan Nezaro not so say kon agenda beyel tigia atsko bakado le so ishim na chekon hanen hiche kodel neto le I just wanted to again say good afternoon to everybody. This is Jonathan Nez, your president. We do have an agenda that we're going to be following and trying to get as much of the information repeated as much as we can. You know, there's a lot of information that's going out to the Navajo people, and I know there are questions. Sometimes we got to repeat ourselves to get the message out there, and we're trying to get every Navajo Nation citizen informed. I know that this was supposed to be on the radio, but you know, it wasn't. We weren't able to make that happen today. But as you know, every Tuesdays and every Thursdays we have radio forums, so those will be continuing throughout the week. So before we start, as always, we start out with the prayer. And you know, while many places around the world are taking out prayer from their schools and their government meetings, here in the Navajo Nation and many tribal nations throughout the country, indigenous nations throughout the world, continue to start their meetings and to hold their people with prayers. So we're gonna continue to do that here. So we have a special guest with us today, our council delegate from the Theru area, Delegate Edmund Yazzie. He's gonna do the prayer, and then he's also gonna say a few words to the Navajo people and our relatives and non-relatives throughout the region. So we'll give this time over to Delegate Yazzie.
Okay, thank you, President. Just want to go ahead and start off in prayer. As President said, my name is Edmund Yazzie. I represent Theru, Smith Lake, Mariano Lake, Pinedale, Church Rock, and Yamato as their council delegate. So at this time, we'll go ahead and pray. Heavenly Father, we come to you today, Lord. We just ask for your guidance. We ask for your strength, Father. Father, we ask that you be with our leadership, Father, all the way from the D.C. level to our state and city and county, and then to our president and vice president, and also our speaker, and then the council as well for the Navajo Nation. Father, during this time, Lord, we ask that you just ease our minds, Father, and we ask that you be with our Navajo people on the nation as well. Father, help us to make the right decisions, Father, but the main intent, Father, is the safety for our people, Lord. Father, we ask that this virus may go away, Lord, and I know there's thousands and thousands of prayers going up, Father, and we just ask and plead with you, Father, that that may be so, Lord. But Father, in the meantime, you just be with us. Be with our livestock, Father, our homes and our vehicles and our well-beings, Father, our elders, our students, Father. And Lord, we just again ask for your guidance on this, Father. Be with our doctors, our nurses, our individuals who are on the front line, our police officers, Father, and people who are working in the law enforcement sector, our detention facilities, Lord. and then all the staff that is helping to combat this problem that we're dealing with now, Father. One day I know it will be over, Father, and we can say that our prayers have been answered, Lord. But in the meantime, Lord, we just ask that again you give us guidance and strength and energy to continue on. Be with each and one of us, Father. Protect our loved ones too, Father. I know some are worried about us, Father. Some are in the military, are away from home, Father. Just ease our minds, Lord, and comfort our hearts, Lord. And we thank you, Father. In the name of Jesus Christ, I pray. Amen. I just want to say a few words to our listeners and to our people. Number one, I just want to say that we continue to support one another and to continue to pray for one another. I know these times are hard, and I know there's people that are out there that are very worried about the finances, about our own health, but we just got to stand strong. And I ask all our people to pray and pray in your own way that this will all be gone. And like I had said in my prayer, I know that's going to be done. But we also got to think of our doctors and nurses who are out there, our medical profession individuals who are at the front line at all of our hospitals. We also need to keep them in our prayers very much. And also our leaders with the council, with the president and vice. This time now that we are ordered to stay home, which is only good for us, for our own well-being. And this is a time that we need to talk to our loved ones, and a time to encourage our students and ask questions that we've never had asked them before. How you doing in school? What's your plans? And this will show our kids, because one day our kids are going to say to their own kids and said, I remember when this big virus hit the nation. And I remember people saying that we will get through this, and so it has been done. And so we need to encourage our young people. We need to teach them how to pray in our own way. And also, I want to say to our law enforcement officers who are out there on the streets as well, taking calls, and not only our Navajo police, but we're thinking of our state patrolmen and our county officers, and also keep them in our prayers as well, because they are the first responders with our EMTs and with our firefighters. And to our leaders from the chapter level, or even all the way down to our land boards and farm boards, and to our council, and to our speaker, and to the president, vice president, that we all continue to work together, we as a team. I know the council has passed numerous legislations to help our Navajo people. And the president, of course, have signed off on legislations that will benefit our people to help them. And also, I know it's very hard for us at times to stay at home, but there's times that we do need to go into Gallup and to buy food and supplies. Watch out for our elders when we do. And let's not be hoarding all the items that are very much needed, such as toilet paper or whatnot. But we all need to learn how to share too, because everyone needs the necessity items. As a nation, I know we can do this. And as a nation, I know we can encourage one another. And so, Mr. President, and to the staff and to all our listeners out there, we'll continue to work together, and we'll continue to help our people. That is the only way that we're going to win this battle with the virus. We got to team up together and to fight this virus. So listeners, continue to pray and continue to spend time with your family during this time. And ask our elders questions. I mean, that's the time. We are doing that at our home level right now. And so support one another. The stress level I know is high, especially with our finances. But we must take care of ourselves first before we take care of others. So, Mr. President, and to our Vice President, and to the Council, and to our leaders with the nation, let's all unite as a team. so we can be there for our people to win this battle. So, President, at this time, I will turn over my time, and we'll continue in our prayers for the Navajo Nation. Thank you, Cap.
Thank you, Delegate Yazzie, and we do appreciate your support and what you're doing out in your region as well, and well-spoken words of wisdom for our Navajo people. Kudo nye beshbahas an linigi Edmund Yazzie jo kudo nye zi hadainolne ado kudo ka natja ahot yasa nye kuila bichirika no nye zi jo ani ahot ashik enollini da isnoltsagi ani ilsko kon deneni glini an ashi ni soda dilzen di nakhailni gi nache koda dilni nigi jo ahot ya yik eni hidna balana danitsen aro anots khoshi hot lana nossen aro kon sad hije kodel yagi edo bedashni tolel shik edo shidna ashwode nanit haganden da sotra judik da nakhailnigi di shladin haut zojit ogia nike ade da hast khanigi do da ist out nike ni hidna shilan kodelana dansen halet nike inadel shi danzeno nakha danzeno ashkenolini. You know, I wanted to also give an update of the cases as of last evening. There are now 115 positive cases on the Navajo Nation. We passed the 100 mark, and we are reevaluating many of the ordinances, the orders that have been put in place. And we are going to begin to be more strict in these coming days, these coming weeks. And I just ask for your patience. And those of you that have been following the orders, and that's many, many of you out there saying that you've been staying at home for the past 2 weeks, and some of the supplies are going down. And, you know, we've been encouraging folks to just send one person to get necessities at the supermarkets. But like I said, there are 115 positive cases, and our healthcare providers, our doctors, and our nurses are pleading with all of us to abide by the recommendations and the orders that have been sent out by the Navajo Nation. Kode atsis pa hayajen daz neligiya nihiked hinne ajen dal nishigi niha alchen yiked an linigi yikedades igi tlachetes kregot eshik enollini jutla ya kon daisonoltsagi nihinat ani do kodo sa nihije kodal yagi haganda ndasot khahat nena hota biken so zinigi do hota nihina nishidal inigi khela akon de ya kon andi nihik nihidna chandakhe eshin shik nollini ashkhode which yadalthe aro chandakhe tabadonne Jukade na the more first of the month ya aja na hol jish. A quiet the never key up a card and da osni ashwanish gain of lini a masan a che nal no linigi kon nal yahba gan ni he da haldo a kon hi ke ni hidna bich ashane da le lain le tlod belgan be kiyat de aden la anda ilni judo bazinda die de kosten tragi nast eits atta bijel yagi en de oya basa hazle ha ela beni nagot a bijel la liana noda jo khodiye jo ban sada kesh ke no lini die de kosten tragi na khil negi ye bat zedot a ni masani hitchen nal basi ti anil tsko ebeni nagot a ben da ni tien dil tsko no wache bi chini khegoshin da ba ya del ti do le kad e ya kodon hik e ni na which ashane del net do le sad ebni na konal sos ni hije be kade ya shone ha ganen da sot kha laeda nen hik e ni na do ni o di kon ni ke ya ta to khalta nada noda sa ni je kodal ne da del khalo e kon al ya ba gan da del khal do le wa sa na hat lo do le ebni na ha gan da so tada di no wata ni jo pa de ni ke ra shode chi ya da no sno e alla bi je ta a do le di kot a e chi ya da ni zin Ngalchen da bedi no e wat out Jan lede nacha da ich nicht do lel. Ot out ka ne chado kisn de ne shode ya di nasnigi na che koda di ni lot ashik e noslin. You know, it's up to us, ladies and gentlemen, to abide by the professionals' warnings. You know, we have first our declaration of a public health emergency that we signed on March 13th. That was even before we had positive cases here. To start preparing, to start planning, just in case something extreme were to happen. We're over 100 cases now, ladies and gentlemen. We are now at 115 positive cases. You know, our health care here on the Navajo Nation cannot withstand or, take care of the many people that are sick that are coming into the hospitals and clinics. Even our nurses, our doctors, our healthcare professionals are pleading with all of us to stay home, to isolate. That was the first order that went out. And then we have 4 additional orders that were signed. One was a public health emergency order to limit mass gatherings. I know today's Sunday. I know many of us go to church, including myself. Many people go to Native American church in the teepees. Many of us go to ceremonies during the weekend. But ladies and gentlemen, now is not the time. I know that there's a separation of church and state, yes, but we're trying to lessen the spread of this virus. And I hate to say that we have issued this order that says no mass gatherings. So those of you that are facilitating these gatherings, we want to also let you know that there's a liability. If someone were to spread these at your gatherings or those gatherings that are taking place, you can be held liable for someone getting sick or even dying. The second order that was issued was for Chilchimbito area and to isolate that spread. The COVID-19 coronavirus, which everybody knows by now that was the start of the spread here on the Navajo Nation. And it came from outside the Navajo Nation. It didn't originate from Chilchimbito. Keep that in mind. You know, it came from across the ocean to the United States, and we pushed really hard. And I want to commend everyone out there and our healthcare professionals keeping the bug out of the Navajo Nation for so long. And there's also the shelter-in-place order, meaning everybody's to stay home. To stay home. You know, yesterday I went to go check on the resources that are coming in at our sites that have the warehouse, houses. Also, starting to prepare for the long run on this. You know, I know some people are going to say, you know, people will say, don't talk about the worst case scenario. But ladies and gentlemen, if we don't abide by the shelter-in-place order, we're looking at a big increase in positive cases on the Navajo Nation. And so right now we are starting to plan on utilizing facilities on the Navajo Nation, hotels, maybe gyms, maybe the correctional facilities, campgrounds, to put up tents, and many other facilities throughout the Navajo Nation where we can use to have folks get taken out of the communities and the families so that they can be isolated. These positive cases, rather than telling people to go home, they need to be isolated so we can stop the spread. If we do not listen to authorities, many people will have to be forced to be put in these isolation places. And we don't want to separate families, but we don't want grandma, we don't want our children, we don't want our people to catch this virus. So help us. Ladies and gentlemen, the shnit diba yashti alla neznatin doba shlatin kun hik na kad di de kosntsagi bedatol na aro kun nits ispa da hayaja hospital clinics and das nelegi kad o khayu da del koso ad shida zato shidol na da no da aden da khe e atishne kojini ni kedi na koja hospital clinics je it's ispa hayaja dal nesha such etes khe sadan Sanat ani ashkonden hik edin na bich yanstje o bich yashtje da bedishne la da ist ata adishnit konsa biln khada de je store godan da khe na yaba gan gon dan da khe ni hin khasla shik eno lini di de nebekaya pa kau da del kalo sha Sala kun bilda jeo ahagan da so tha no sha did le at leto nandla koda haut ni hida ze hot ada dil ni da di no bansde kes bini nagi ni he massa ni he chen nala basi di kon nasligi ebini na hot lego khadit shnabel Vice President Myron Lizer Kwande en need a teen that del kalo konal sosen de neo hadina. Ha elabin ya kon hilkat je di konal sos ni keni na kon bil keda hat inigi bich ashane da set abdi no. A konde a da di chin de shiko a teen gon da je. Nakhanda neshigi di ni Washington sa anigi ni ke ya konne La ni edihin na ndal nashot jo hot di ni Washington il was de shibel nda jeto lehne. Intiwe da agida. Tukoje ikida des ingi. Tude tlanigida. Nal yahba ganjin dal neshigicho yesi. Nakhan dal nesh kon بالخطأ دليلو أبعاد أكون إدشنيت نيجي كي يعطي الكالوشا أخذ نيجي كي نيجي دا إيست دولة خلا صناعة ليشي دولة شا أخذ نيت إيلا دنيت ليني نينات لا نيجي كون نيجي كي يهاد دست كال ناهت ني دولة أكون ده كدو نهيك بعد نحن بني نادا دي نشيك نحليني دي كجت تكون ناس تزجدو تكون ناس جدو تشنلي جشين خيوشين كد نهيك نهن لآدن دهاز تخلى شيء دو دي نحلنيجي دو بدا هالون دانده جو كون كوي جنت الكوستي دكوسيجي لا دو allergies دات اجي لا هيك اني ندال تسديجي بنينا اكون نا تسيس با هياجن داك تسدا شتول دا نودا اكون ده ني مسا ني تشين نال كدو ني هيك ايدان لينجي ني كون تسيس يا دا ليانجي زل ان اجه يكيدا داز إنجين هيك إني الناجا أيدي يا يسي كون تيجة بكا نيجا تلاقي بيج إدي كا أنين دي كخيجي شك إنو ثيني نخا خات نيتزنو دشنا شك إنو ثيني. You know, all the orders that have been approved, there's going to be another fourth order coming out. I want to let you know it's going to be time for us to have a curfew. The curfew will start from 8 p.m. to 5 a.m. Monday. We need to slow down people traveling around our nation. We have already said to our visitors, all our tourist destinations are closed. Points of interest are closed. Please respect the sovereignty of the Navajo Nation. We have 115 cases. We don't want to go off our nation and to get other people sick in the other areas out our nation, and then vice versa. We don't want our visitors coming in with the virus and increasing the positive cases here on the Navajo Nation. And I was saying in Navajo, ladies and gentlemen, and young people especially, I see many of you driving around throughout the Navajo Nation. Some of us, some of you, some of our people might not know that they have the virus. Don't be selfish. Think of your grandmas. Think of those people that have health conditions, because those are the vulnerable population that could really affect in a real bad way. Right now we have deaths on the Navajo Nation because of the spread of this coronavirus. And we need your help. We need your help. Government can only do so much. I know that many of you are saying, shut down the government, President. You should have done that 3 weeks ago. Guess what? Those of you that are saying that, if I've done that 3 weeks ago, you would probably be the one complaining about the shutdown right now. This is serious stuff. We got the first of the month coming up, and we need to restock the supplies for not just our elders, but everybody. And tomorrow is the start of our curfew from 8 p.m. to 5 a.m. in the morning. There should be nobody out there, only essential personnel. When I say even that, people don't understand. You know, we have these information, young people and the people out there, on the Navajo Department of Health website. All these orders, please read them. There's a lot of questions that you're asking. If you would just read them, it will answer a lot of your questions. And I'd say that with all due respect, everybody. I know some of you saying, President, you need to get stern. You need to put your foot down, you know. And that's what we're going to do. We're going to talk about an operation on 1st of the month. We want to close the supermarkets here on the Navajo Nation for a few hours so that our elders can get their supplies. And then after that, it's going to be time to hunker down, meaning to stay home. Please help us. There's also on the webpage, and I know somebody's going to say, well, not everybody has internet access. Then share it with them. Frequently asked questions. Over 26 pages of questions. Many questions that get repeated over and over. Take a look at this. It's on the website. And those of us that are English speakers, share it with your relatives and our families. And those of you that are Navajo speakers, translate it. Come on, help us out, everybody. It's not only have to come out in the Navajo language from the government. You can translate it. And our next forum that we're going to have is going to show you some charts. You know, outside the Navajo Nation, they're talking about this curve. The curve is a bell shape. That top part there, the top of the bell, is where that's when all the cases is going to be at its extreme. This IXS chart was given to us because we did so well trying to keep the bug off our nation. We have yet to even start going up on this curve here. While many of the states out there are going about, maybe they're halfway on the curve, we're still down here. So there's going to be a big uptick in the spread of virus if we don't obey these ordinances. They say flatten the curve. You know what flatten the curve means? This is so way up there. They're talking about flattening it to the red and the orange there, if you can see it. But what I'm talking about here is that we want to be able to flatten this curve, not to peak out. Our peak we're looking at is probably in mid-May, late May. That's the prediction that we have. Not to scare you, but that's just by what's happening off our nation, like in New York and California, they're skyrocketing. There's not enough ventilators. There's not enough masks. There's not enough gloves to go out. But, you know, we have our own glove manufacturing facility that's helping everyone here on the Navajo Nation and also helping bless others out there. That's an investment made by your leaders, and it's helping out in this emergency. Di jeta gazi lachishidalnet. No hota belanta si tlinat anini tlinigi. Nast tsata the mil tsohanel peso belazli. Ek adnle church rock je kinskagi de kushinache osa. Kodo yati jeta gazi lachish be ni ani hini hik na aday etel ido lesa nana ek adil was ekon kaditi chish lachish ohot ya akai je ni hik hinna pa edo kon de nabike ya pa ka ba ka na alwo adon let ojeto which in da il niti lachish jeta gazi bed dal yaki jo Asian all yat ahojit ego ani hibini ka no da ni tine ek adiche bida hilza. Lahot an dat not hinigi he la. Ani hebini ka ani hel ka I je da don nenigi he la. Do e kon tsaga hot zan bich da do ida. Di kon tra nas nele kindaz nelego do bich da do ida. He ka o je ni masani he che ni nele ka o je gi he. Lai ahandi shada hat no da yada atye. Ahojit ego hat nene binda hadil atish no adishnish eno tlini. Jo e atish di kon je tagazi na lajish adil negi ot jo e ot e da ilia the nebikeya pakao. So look at the frequently asked question sheet on the Navajo Department of Health website, and we're going to do another town hall to give you a lot more information. And we also have an organizational chart. This is from the Navajo area IHS. They're doing their own organizational structure within NIH. Navajo area IHS, I'm sorry. We here on the Navajo Nation have the Navajo Department Health Command Operations Center, which oversees this whole Navajo Nation operation, including Navajo area IHS 638. And that's the facilitation that we do every Monday. The more is kanagona kudon hinat ani don ndal neshigi the navike apakao asahande tle yin dal neshe nihiche ashane dele kon atis bahayajin das neligi twinnes diz twinnesh je chin lige torche jud the quishi hota clinics do hospitals and das nel the navike apakao kujido Teho Tsoja do Ajado Sage Aro Winslow Jida Gallup Indian Medical Abeshisla Hande Tle the telephone be Monday gonna Ahot Nilsko Bendale Neshigi Nichilpeda Hazen Koje ya east at east by Hayaj the Lajish at Dastin that the no the hot kodo Beka nature, Lajish bitch a coda deal, Nilta di no, Joe hot as ka nature, those kissing dailnish. Yenat ani do, Beshpans ando dan linigi, Kodo bandate inigi a bitch ashchan a dadne. Tra nas nelik at con asa nezatino nezna, das neliginat ani tra nas nel dan linigi a do tra. The East Atle Monday go dik at the scar she ot out na nate let ole. The more bahanegi kodo alsko got anil skokan del neshkin hilbeda hazen kon nihik eni hidnado ajin dal neshigi yin dal neshigi jo got a sad hije kundayil. You know, every Monday we have this Navajo Nation COVID-19 preparedness team meeting. And we are putting this meeting together to get everybody on the same page. We help facilitate that. We know that each healthcare facility has their own operation, including Navajo area IHS. But at this time, it's critical and crucial that we're all on the same page and working together for the Navajo people. And now, starting tomorrow, all 110 chapter officials will be able to listen in on these updates. The same updates that we've been giving here, but let me just mention that we have approved some legislations. We approved a $1.3 million chapter emergency funds for those chapters that are under $25,000 in their emergency fund. So replenishes them to that $25,000 level so that they can begin to strategize. The other is to reduce the quorum from 25, some have 15, some have a council type of governments, but down to 3 registered voters. During this time of emergency only. Once the emergency's gone, this goes away. I bring those 2 up is that chapters are now having their chapter meetings using this 3 chapter membership, chapter official rule. So they're going to start expending emergency funds. But I just want to tell the chapter officials once again, and I said this when I spoke to the chapter officials on last week when we had 110 chapter officials meeting, is that those officials need to be trained on how to hand out items to our grandmas and our grandpas and our nullies. We don't want to be handing out items when grandma's way out there and they don't even have the virus, and then here we don't even know we have the virus, and then we give it to grandma. We don't want that to happen. So there's training on how to use gloves and how to use masks and how to use the personal protection equipment. And we need them trained. And then we're going to have some of our division directors speak on that in a bit. So please keep that in mind. The other is a donation. There's a lot of folks who want to donate to the Navajo Nation. So now we can accept donations. Speaker Seth Damon and myself agreed to getting dollars from outside organizations so that we can centralize it. Everything should be going, ladies and gentlemen, everything should be going through the Health Command Operations Center, the HCOC, so that we know we don't want groups coming in handing out items without the HCOC knowing, because we need to make sure that items that are being handed out are cleaned. They don't have no virus on there. There's ways to do it to get it out to the people out there. I know that church groups and other nonprofit organizations are wanting to come in. We don't want anybody to be scammed too during this time, so you need to also remember that. There are scammers during this time wanting to come into the Navajo Nation or actually asking for donations to help the Navajo people. And we don't want to do that. We don't want to get scammed and taken advantage of. And that's why it's important that the HCOC be the clearinghouse for all of this. Those are the 3 bills that we've mentioned that are dealing with the local chapters. One that's nationally is approving the FirstNet operation. Delegate Key Allen Begay's legislation that would get telecommunication, internet access to our first responders out there in a quicker way. Yesterday I was in Tuba City. We got fiber optics that only go so far. We need to get that fiber optics to their command center there at the fairgrounds. They're planning there to put a distribution site there. Also maybe even a bigger, larger area where donations and supplies can go there to the fairgrounds in Tuba City. And thank you to Mike Sixkiller and the Twin local government for working on that. There's also going to be a mobile hospital that's coming into Chinle sometime soon. More like a MASH. Some of you that are in the age of watching MASH back in the day, those big tents, temporary facilities. So those are things that are coming into the Navajo Nation that we need to get internet access to. High-speed internet and cell service. And so I know I've spoken a lot. I love each and every one of you out there, Navajo people, and I say what I said in love, and we just need you to take care of yourself. Everyone out there. Ni beshpans andan linigina tsosi yelata asleon hije kodayilla. La eya na dinish la demil yaje enelt al beso ekon la Tra naznele kon nat ani dan linigido aje hik da des igi jo e kon pesa biche kundal e kon hik e ni neba be ka na alwo. La e koje emergency funds igi do lab pesa be da halon da e kon al sos hadel yagi do be la da de be la zlingi do kdosh na nije be ka il yagi e kon di na din shla de mil yajenelt la peso to chapters be da halonigi emergency funds e kon la bihindo zo hat no what na sos be la zlin alla de mil sotoba a tra nezna din de mil yajenelt shinla do e altsko di chapters alla nezna din do a nezna biche kodlneta jo dilla peso emergency funds do be da halonigi e kon bihindo zo hat no la e aita peso la ni he da halon e shik at chodal in do le ado ataso do ata da holnya de shinigi di kon na lachis chodal in do di kon mask dat egido ajendal neshgi chodayol on jondo le ashon ni masan ni chenan le da asahan da has khane do di virus no ako ni he kodo e ya di chiyanda jo clean dal ya e kodo ni ke any nabje kodel indo left di no what nalt sos la hadel yago tashik eno leni ado kum behaz ani do juk atla ni he tranaz nele kon atla handa atleo na din shla anelt e ya nalt sos be landa itle ya la e ashla tsata la ani he Washington ani he chapters council adat egi dalla da hot da yosye ako di korm hat ninigi na dinish la e tra do nil hat do nil e bininagi di kon di COVID-19 igi coronavirus hat ninigi di oshtoit ini nakhailni igi e de biniya beso da do hat ida nalt sos belanda itlegi be belanda atleto let so di tra korm hat ninigi so ishi on his thousand dollars eno lini o khyu ba han ba da hil net di jido o you nakha da han net di konla ni hik eni na nakhanda ne shigi atsela de dan linigi don hich hadat zito leltiche. Just going through the bullet points again, you know, there's a frequently asked question page. Take a look at that on Navajo Department of Health. We're going to be reevaluating the school closure and the government closure. I know that we're going on our third week this week, and we closed it for 3 weeks. We are looking at extending that too, just as New Mexico extended theirs. We'll also talk about the first of the month operation so that our elders can get their necessities, their food, and their resources to stay at home for the next 2-3 weeks. I also mentioned the legislation passed, the donations I mentioned about wood, food needs to be clocked in. We need to also keep track of our dollars that are being spent. You know, the federal government, which Vice President will be talking about, is giving some aid to businesses and you as a U.S. citizen. So he'll mention that in a bit. So it's important that chapters keep track of their expenses too, as well. So I'll end with that. I know I spoke, pretty lengthy, but you know, for the Navajo people, please abide by all the safety precautions, all the ordinances that are in place. We will get through this together, and it's up to each and every one of us to help each other out, to explain these ordinances in our Navajo language, and to also, most importantly, pray for our first responders, our doctors, our nurses, our police officers, everybody that's on the front line, those that are giving food to our people in Chochimbito and those that are affected by the COVID coronavirus, and which is everybody, but those that are tested positive, we're trying to get resources directly to them. We have to abide by privacy laws, and we do our updates every day to the news media on these cases. So we have the ability, ladies and gentlemen, sa da ba khagin hije kodal ya lego ba da hol bich ashane da let ni kedi hinne ashode a hot a di kon khai ni khail ni gi do di kon ba yashti gi do yego na khadol neta ni he da nit ego de yashik eno lini ashode kon ni jo ba inshket ni so de zendo kon Nihik any ba inchke dodle con it's east ba hayajin dal neshigi doctors nurses dan linigin hit salada conch ian de nigi but so da dol zen ashronde beach edi khati con de kosen tsraina states atta el kai je do kishin de nesho de don nil Aaron hik masani hit chain nala ashronde bi da I Bada Hosia, Nihal Chindo, Ako Kodoe di ni President Jonathan Nez, Kunso Shini Hitcha Sito Lel, Hadai Nosle, Ado He Shindo Lel, Loikon, Shina, Vice President Shigato, Zinigido, Shika Nalwagi, Doe Shikeren, the Sadada, Kodo Shigato, Shika Nalwa, Hot our Ilka Nate, Ashto, Ilka Nature. So Kodoshin, he Vice President Myron Lizer, and he
Thank you, Mr. President. Yat Edo, Shikero, Shida She Myron Lizer, in the She, Comanche Neshle Tolane, Bashis Chin, Comanche Deshache do, Klashi Deshanelli. It's good to be with you here today. As we shelter in place here, rest assured that the Office of the President and Vice President is working night and day. We've recently formed NEST, that's Navajo Economic Stimulus Team, where we'll be establishing the team to work with our congressional delegation, federal agencies, and state partners to expedite and deliver federal funds and resources that were appropriated. We've been in discussions with the White House numerous times this week. And on a legislative update, as President mentioned, the CARES Act was passed Friday. The Corona Aid Relief and Economic Security Act was passed. This brings economic relief to individuals, families, businesses, local and state governments, and tribal governments and entities across the nation. The bill establishes an $8 billion tribal relief funds and provides $2 billion in emergency supplemental funding for the Indian Health Service, Bureau of Indian Affairs, and the Bureau of Indian Education, and HUD's Office of Native American Program, among other federal agencies and programs. In the form of an advanced rebate, taxpayers will receive a 2020 tax credit of $1,200 for adults and $500 for children under the age of 17. This amount is reduced for taxpayers with an adjusted gross income of more than $75,000 a year and phases out completely for those with incomes of $99,000 or more. It also includes unemployment benefits and assistance for businesses. Below is a brief summary of the CARES Act benefits and funds specifically set aside for tribes. $1.032 billion for the Indian Health Services accounts, which includes up to $75 million for electronic health record stabilization and support. Allows up to $125 million to be transferred to the IHS facilities account. At least $450 million shall be distributed to direct service tribes and self-governance tribes. On a public health, The minimum of $125 million is set aside funding for tribes and tribal organizations under the Centers for Disease Control and Prevention, or the CDC. Funding is for surveillance, epidemiology, laboratory capacity, infection control, mitigation, and communications. There's a minimum of $15 million in set-aside funding for tribes and tribal organizations under the Substance Abuse and Mental Health Services Administration, or SAMHSA. Funding is for mental and behavioral health services in response to the COVID-19 crisis. Minimum $15 million in set-aside funding for tribes and tribal organizations under Health, Resources and Services Administration, or HRSA. Funding is for health surveillance and other needs under the HRSA Rural Health Program. Housing. $300 million has been set aside for Native American Housing Assistance and Self-Determination Act, or NAHASDA. $200 million of that is for Native American Housing Block Grants. $100 million is for Indian Community Development Block Grants. Under nutrition, $100 million is put aside for the food distribution programs for Indian reservations. $50 million of that is for facilities improvements and equipment upgrades, and the other $50 million is for additional food purchases. Additional provisions, $8 billion for tribal enterprises, and the Special Diabetes Program for Indians is extended until November 30th, 2020. And so this is what we're working hard on. That's what NEST is working on. Again, the Navajo Economic Stimulus Team, that we're working hard to encourage not only our congressional delegations, but also our own very Navajo Nation. And we're pushing one very, very important message: stay home, stay safe, save lives. As you can know, that this is a vital, important message. And our president had spoken on, several things that we're working on here, and there's a myriad of issues that pop up, and so we have to address those, but we're also trying to be proactive, and so this is one of those ways that we're doing that, using social media and radio and the like, and so we'll continue to do that until this crisis passes. And so I just want you to be rest assured and have peace of mind that the Office of the President and Vice President and your Navajo Nation Council is working feverishly and will leave no stone unturned into delivering safe and effective methods on which we can bring funding to Navajo, but we can expend it wisely, being accountable and transparent. And so I just want to leave you with one last thing. Many know that I'm a former pastor, a minister, ordained minister, and a lot of times we say that our Creator has a sense of humor, and He also knows everything. He knows it from the beginning to the end. And lastly, I just want to leave you with this little tidbit that was brought to my attention not too long ago. Isaiah 26:20. Go, my people, enter your rooms and shut your doors behind you. Take cover, for in a little while the fury will be over. I find that very comforting words right now in this moment. And as you know, all of our nation and the world is undergoing this great crisis, we know where we can look at, we know where we can derive hope from. And so as the Office of the President, Vice President, and much more, this Vice President, I want to continue to let you know that this leadership is praying for our nation. We're invoking prayer across those that would understand and be called into prayer and fasting. And so we know that there's a way and a method that we can enact God on our behalf. And so one can speak for thousands. One can speak for all of those that are out there. And so again, go, my people, into your rooms and shut your doors behind you. Take cover, for in a little while the fury will be over. So from the Office of the President, Vice President, and this Vice President, Myron Lizer, we appreciate you one. We love you all. Stay home, stay safe, save lives. And for now, we're going to receive some timely updates from our very own Dr. Jill Jim of Navajo Department of Health, and she's our director. Take it away.
Well, I just want to say good afternoon. My name is Dr. Jill Jim. I am the Executive Director for the Navajo Department of Health. And I just want to welcome everyone that's listening. And thank you, President, Vice President, and Honorable Yazzie for doing the invocation this morning. I just wanted to update and provide information regarding the COVID-19 response team. So under the Navajo Department of Health, we have a declaration of public health emergency from the Emergency Commission that authorizes the Navajo Department of Health to respond to the public health emergency. In this declaration, a health command center is located in Window Rock, Arizona. There are several sections of the incident command system that we're using in response, which is led by David Nez, who is the incident commander, as well as several sections as a liaison, indicating that these individuals are communicating with local health departments or other tribal elected leaders. We also have a safety section that also looks at the response in the community and also within the command center. We also have a PIO section, and that PIO section is public information officer is led by one individual, but we have a JIC. We authorized our Joint Information Center late last week here. That means that all communications with any news outlet or health department or hospitals, if there's any information going out to the public, it is timely and accurate. So that is the responsibility of the JIC group. So I hope that when the information is made public, it should be cleared and approved by the JIC section as well. There's also a finance section, operation and logistics section, and planning, and lastly, situational awareness. Under there, the Navajo Epidemiology Center is the lead entity to announce and confirm and report positive and negative cases. And this includes coordination with Navajo Area Indian Health Service, as well as the tribal health organizations, the state and local health departments. So it's a comprehensive effort and team that works on this every single day to give a situation report at 5 p.m. every single day for the nation. As you know, we've reported around 115 cases so far, and many pending tests are still not shared yet. One of our other important role at the command center is we're also the hub for working with partners and also including state and local health departments, as I mentioned before, and specifically because we are in a medical and public health emergency. Under our essential support function of an incident command, we are working collaboratively with the Navajo Area Indian Health Service, as well as contract and compacted tribal health organizations, which is hospitals like Winslow Indian Healthcare Corporation, Tuba City Regional Healthcare, as well as Utah Navajo Health System, Sage Memorial Hospital, Tohoto Medical Center, and as well as the 3 satellite clinics out in New Mexico. And through our efforts and communications with the state, we are distributing resources through all of our first responders and also hospitals from the stockpile, which is what our medical supplies needs that come through the state and CDC. So those are the collaborations we have on the medical side. I just wanted to ensure that there is a structure in place. So one of the ways that to address your concerns as a citizen of the Navajo Nation or a visitor, that you have a phone number to call to, which is 928-871-7014. And then if you're from the Chilchimpetua community, you can call 928-871-6271. And I just wanted to reassure everybody that it will take everyone to stop the transmission of COVID-19. And also one iteration of when we're talking about the disease itself, as we always mentioned before, that is a respiratory disease that is almost like flu-like symptoms. So the transmission is very high because we cannot see, we cannot feel, we cannot smell or touch anything regarding this disease. So it's very important to take precautions, as we mentioned before, around taking care of yourself and also using similar prevention methods as hand sanitizer, soap, social distancing is very important. In these next couple of days and months to come, we don't know when this will stop, but the best thing we can do for ourselves and also protecting our elders and those that have underlying health conditions such as diabetes, lung disease, cancer, heart disease are very individuals with very high susceptibility, meaning that they're able to get this COVID-19 more likely, and it will also have more of an impact. We also knew that early on that the COVID-19 was more impacting those who are older with underlying conditions, as reported through China and other countries. But in the U.S., it's slightly different. We're seeing cases that are in the younger age range, and they're also seeing fatalities that are a lot lower than what was expected. So I just want to make sure that that we can go ahead and ensure that people need to make all the precautions that they can. Doesn't matter what age you are, doesn't matter what health condition, if you're healthy or not. And also we need to do our part. It's our own responsibility to take care of ourselves. And then statistically, the U.S. is #1 in the world as far as number of cases. And then within the United States, we're also #1 in the Navajo Nation among all tribal nations. And so lastly, I want to ensure that those wanting to support COVID-19, there is a structured process to reduce any kind of risk to anybody when you're providing assistance. So those wanting to do monetary donations or even just providing food or resources, please contact the command center. We want to make sure that those resources are handled properly with individuals that are trained to provide resources in the community, because the one way of doing things before was that people can probably just bring a bale of hay or bring food supplies to donate or a number of things. But if you have individuals not wearing gloves or possibly not wearing PPEs or other gear, depending on what's being donated, that can also increase the risk of transmission. So I just want to let you know that there are ways and avenues, but just know that you can call the command center line to get correct instructions. Ado ke non kedini do non shik edo shidene she look on short kachini bashashin do ishin do she do azalona e dashnale ado kwadi it's is ba hayan je e kwat big edin do kwadi a quishin kwadi declaration holyani kwadi nikadet kwad big edad need do kwadi Besolane kwadi command center holyani kwadi a quishin and then at the des do hadi safety holyani do liaison do finance besa da beta that gido haida hadi the medical supplies that the holyani do the todo ale the netins in the kwaltro nahat do kwa also beto hadi could he cause and he didn't object but the hate nilo things in the door be like a day in a year what but the lucky command center holyani and died that kid go a quadi the hasna AA 928-871-7014 Ado kwabit and dale nishiti kwat is bahayanda de it's local health departments Talyani do state health departments do the Navajo area I Chester Ado kwadi is there in the healthcare corporations kwadi on the Navajo Nation do habit and dale nish do the kwado EMS Talyani do hadi kwadi bit and dale nish the COVID-19 response benia the question tagi 19 Olyani Ado nadi nidi ashin here kwadi the question tagi Holyani ankin is better hasn't do hate other be big edget be the kwadi it's Holyani do the hatkanes girl do hadi ba hajins and do is in either the yego betkiso kwadi do katrani ka a launch or hadne that I know the quidishi be had the zido ashi what abena better in do non ado kwadi di kosantagi e dishini e they do it in da do beta dilni da do halye do behas and da ein na kwa ejo da halyan do kwadi ashin ke which it ego shot da ni le ashi hot ba da ni zon shi de hot beta in do so Shik Asia the Nadi, Qua Engino, Hadi, Data Haliato, Hawandan Daiso, Trando, Yegot and Arcado, Quadin, Yamasana, Do Qua Data Nasinoba, but a data Heliado, a data Hanitsando, a day what I hear Nadini. And I also want to also introduce the Navajo Area Indian Health Service Area Director, Ms. Rosenslow, will provide some information to everyone. So thank you, Rosalind, for being here today.
Thank you, everyone, and good afternoon. Again, I'm Rosalind, so I'm the Area Director for the Navajo Area Indian Health Service. With that, I want to just give you a couple of updates with respect to the information that we are working on. Again, we continue to work side by side the Navajo Nation as well as the Navajo Nation Command Center. And with that, we continue to monitor all the cases throughout the Navajo, throughout Navajo land, and we will continue to do that work there. As you have already heard, the Navajo Area IHS is working and has prepared and shared what we're calling a patient surge plan. This is what we anticipate based on what we have seen so far, and what we need to do to prepare our staff and the services that we continue to provide. It is essential. I cannot say enough. As the president and his staff have already said, the social distancing, staying at home is absolutely key. That is the only way that we're going to minimize some of the cases that we anticipate to see. As part of the surge plan, we are desperately working to secure what we call the PPEs, or the personal protection equipment, for all of our frontline staff. This is essential and critical, so we've been working again side by side, the Navajo Nation as well as all of our federal colleagues and contacts that we have. Our plan also includes a plan for quarantine, and why this is important is that there are people that need to be self-quarantined, as already been talked about, and then as people get better, we'll need to find a place for them to go to completely recover before they will go back into the communities. This is what we're calling step-down plans that we have, and as I shared earlier, these plans have already been made available, and we will be discussing them more as we continue to move forward with our situation. Most importantly, we are continuing to actively evaluate and monitor the use of our PPEs. These are our personal protection equipment and supplies. It is absolutely necessary that we have these for our staff, our frontline staff and providers. As we continue to move forward, we will continue to shift staff as necessary. We have already done some of this already to meet the needs of our patients as these cases present. One of the critical things that we're waiting for, we're hoping that we'll get this week, is what you have and what we're referring to as rapid testing. This is our ability to test in-house, and we're hoping that we will get responses back or results back within a matter of hours versus days. So this will put us in a much better situation and position in terms of moving forward and determining how we might be able to best address the cases and the situations that we're in. So this is coming as a positive change for us, and we're looking forward to getting these tests in hopefully sometime this week, and we will continue to communicate the changes as they arise. We will also continue to do what we would call tracing. We're using our EPI response team to continue to evaluate any positive case and where these patients have been. We are stepping this up a little bit more because this step is absolutely crucial to minimize, again, contacts and exposure that some of the positive patients might have, even if they don't even know that they might be carriers as they work and move through the communities. As I have shared before, I am extremely concerned about my workforce. If you're out there anywhere, you have family members that work in any of our facilities, please give them a hug. Please be nice to them. We cannot address this issue without the use of our first line providers, our doctors, our nurses, and our medical teams, including all of our housekeepers. They have become, and they have always been, but they are very essential here in terms of our ability to make sure that we have clean space as we continue to move forward. Lastly, we are continuing to work very closely with our partners. This is Indian Health Service. IHS is closely monitoring us and supporting us along the way, all the way up to the Department of Health and Human Services, and including the White House as we move forward. We're also working side by side with FEMA to address the requests and the needs that we have. Again, I cannot say enough. I want to say, again, please be nice to our healthcare providers. If you haven't seen any of them, if there's anything that we can do to support them, I sincerely appreciate that. Thank you. Okay, so the next, it's my pleasure to introduce Dr. Pearl Yellowman. She will be the next presenter. Thank you.
Thank you. Aroyat e do hiha. Shay Pearl Yellowman in Shay Ado Division of Community Development Ada Sida Ado hiha. President Nez, Vice President Lizer, Beish Anigi a Delegate Edmund Yazzie hiha. I just want to share the updates from the Division of Community Development. The Division of Community Development works closely with the Department of Health and the Command Center. And all 110 chapters, both LGA certified and non-LGA certified chapters, remain and must comply under the public health orders. And it's really important that we communicate and stress that we are all part of the public health order, and the public health order applies to all members and branches and to the 110 chapters. Some of the topics and some of the priorities we have been addressing through the Division of Community Development and the Department of Health through the Emergency Command Center is solid waste. We are working with all 110 chapters to address solid waste and the importance of these continued efforts and services for solid waste. We are also addressing the language for essential services during this time. As you know, on March 13th, the executive order and the declaration of emergency was issued, assigning all essential and non-essential staff, identifying all essential and non-essential staff. This included staff at the chapter level. This also established the grounds for the chapter house to be closed for large or mass gatherings. But the essential administrative services still remain a function of essential services through the chapters. Today, those services include water hauling for livestock, and at some chapters, senior citizen center meal pickup and drop-off services. Some chapters also include or have services for U.S. postal mail services. And some chapters also provide propane and kerosene services for our chapter members. And it's very important that during those essential services, all delivery and pickup items adhere to the emergency and public health order, that all individuals must be protected and utilize the CDC recommendations and the recommendations from the Department of Public Health and the Emergency Command Center. It is important that any and every essential item that is transferred from one individual to the next individual is done so with the utmost importance and precautions necessary for our Navajo people. I also want to stress that we have sent numerous language to our chapter staff and chapter officials. Ashana, please take the NIMS, NIMS 100 and 700 online courses so that you are identified and understand the common language under the Emergency Command Center and structure. We're also encouraging all individuals and all Navajo Nation community members to type 888-777 Navajo Nation to access the wireless emergency alerts. Also, again, relating to the chapters, legislation CMA-09-20 was established and signed, and that allows for the quorum of 3 to conduct administrative or conduct chapter-related business revolving around the COVID-19. And that's, again, legislation CMA-09-20, which allows during the emergency, the declaration of emergency, for the quorum to be 3. Also, again, the Division of Community Development and the Emergency Operations Center will be working closely with all 110 chapters to utilize and access legislation CMA-11-20, and that's for the emergency funds at the chapter level. And I cannot stress enough for this legislation that this legislation allows us to access and remedy some of those solutions at the chapter level under the emergency precautions and guidelines of transferring goods from one individual to another with the extreme and utmost protection from one another. This does not mean that the chapters are open to emergency management plan groups and CERT groups. We cannot gather no more than 10, and this means that we have to suspend any type of emergency that had once been related to droughts or fires, as we are dealing with a public health concern. So, Ashona, please protect our staff, protect our community members. This does not mean that the chapter opens up for large gatherings or large volunteering. So again, please understand and use the utmost critical care for our employees and staff. I also want to address that at the chapter level, we've been working on a case-by-case language with the Department of Personnel and the DOJ division to address burial services. We are advocating and ensuring that any chapters that bring in an approved essential member or volunteer who dig the trenches or do the backfill that is burial related are protected and wearing the proper PPEs. And again, those are case by case. We're working with all the 110 chapters. So again, it is at the utmost importance that we protect our community members and any of our essential employees who come in and they must wear the protection. And before I close, I want to thank all of our leadership. I'd like to thank all of our first responders and our public safety. And again, thank you to all members who are continuing to serve the Navajo Nation, who continue to communicate clear and accurate information, who continue to advocate and communicate for the safety of our Navajo Nation people. We all have a responsibility, and we all have a responsibility to educate one another. We have many relatives who are not on social media, and we have many relatives who live out in the rural area of the Navajo Nation. It's our responsibility to educate clearly to them the precautions and the necessary means to be safe during this time. And again, please access 888-777 for the wireless emergency alerts for the Navajo Nation. That concludes our updates for the Division of Community Development. I'd like to now introduce Dr. Fowler from the Division of Personnel and Human Resources.
Yat shikado shidne etahuis ane da isnolts aido nihilkane de ado hashil soko nihigana ade do da inolt hashido hashil so shil atin daltnish shikashidne ado kebeda kehit a hashine lanchi shaalchine danolle ado shiyaje ewe danolle ado ya kon has twi sani silke jk dan lini o yu kon ni hit nebe khahot zogi biye hashin soga kodo ni hit khasti dole shady ma ideshki ninchle ado thudich ni bashchin Ashe dashanaldo trapa dashe. Trotus ahol yene ade yise chesheke. Ado ya di nanish basic odini ya hashin sogo nalnish big dest inch aj ya shinanish ado hashin sogo behes ani lini ndak aswalini aj do big edinch in. Okodian nido the quiz kanye dancing ya baj ohota do a creature kodoben hitri adatki the question sarnast aids ada bebet ocho hashine launching kodo hata hidenesti do hashine launch ekwa do all ile go ata ilianle akwande shik ashidne ashin hashin soko kodo nihin nasla Nihit so de zinda hallo. Ado a be enil soido be enit a ya kodo ben hiln da huilne. Naha dan hinne I benna dan hiditne shik edo shidne. Tilk HK ado shi yajish away. Hashid ad a keta hiditne ni bennaje. Else ya di nas nishno linigi. Na nish nihilek nazlahi. Kashin sako khahalane na nishin linin hilik nazla o you kon ni hitsit kedo kedan lini na nish ba daten o kona nish hilik nazlani yego ba khulnya dotenussen Kashin sako ni hinat ani hollo edo nat ani ulyeni tatinussen leho Kashin sako Ben hiln da huilne be has ani lini o yuho be nta nitkin do ben ta alkinitkin edo bik eta huinol shik edo shidne ndal nishi khashin soko ka adi de kosen side ho jo bahan net da hanni ani hito ndal kha anihye be etahol a khashin tso kote FEMA 100 and 700 tabedine be etahol a do anihye na betanotha ado hashin tso beshi chila nihye daholo ndal kha do anihye nat ani nit linit ena khasalada nihido latona khanazla nihido lato benta nothindo beniye lato tan hit isnel shik edo shedna khajin tsako nat ani chin hollo a at en dahi khahi edo lato ashade shatadino senta alhidino senchik edo shedna ado hashin tsako di command center bedine e aj ade nahat anleni ad elskal ke yonnetli nihido lato ado bik etahuinil enle ako hashin tsakoti chan atahi to tan hidetni ay a nikon hidetni shik edo shidene khala di bez ani khadil yado bed ije ikbekal yake ado chanat tehe biniye holno e a ani Ezel ingo da tota chinyan da hat onwel e ani hi honwade na kha nasla en lede a dina da has twisani da holnone do chon da hashkende a kho santa da hodni di lato bit khadi ya hi ben ina dishne en stsie da ado kiko da lo da no ot da hat iskende Yahiden tje da hat Nihland e a ni da ninde do yat hi holno a de klo da hat nene e shi di a hilne shik edo shidene hon wat de sunta en lake go e yuwe wat Nihland ye go da hat iskende ye ya ba hat zet da hat no da e ye shik abanda hwishni shik edo shidene Hon wat de nasko ben not niet kin doshi niet e on hit handlni it eda sho de niet zili shi yenan hit de not kin got de yin de nehni do da halya da de shnile e shi ko wat an hit neintla khaleit abna antkin nlini do be ol il hit de hande do kha nini shi da holna alto e shi benina hot bi khansel do lato akonde nde osh khot edole khajo sadia at sa digini gi todezin ya dat be elhine khegoshi be lady khashik edo shedene akoti aji gi ya di has twido sani bit nata ilie la iol khato la etra iol khato ne Hashin tsako ni hit nata ilie akonna e belko ahigi eti first atama thelne akonna ha shi chiyanchi la hatasto khai akodi belko ahigi eti tsaka ho zande adon le tselchi da haskanda da hasne tolch ete chinlela ado tonanesteze adon le toteneshe ist ozata the ditch yambal nahas aniki his twido sani no leniki na kha alne to le his tra de ko benno alla ayol khalone adon le alla hadje ln ado bikje e aj na kha at edo le his twido sani leni akwande ni hinch kedi eti atso ke analike da holno alchin da holno e akompel da to kha ohon da na khato gal ado ade achiyade ntahaniten dalneshi ade to as twido sani na khata dinosen shik edo shitne ade le sato ka shama a I sita shama sana a I sita ado epa ya isha ta nini to hollo khajo belnta dolnesh e aje hol jigo ado ti ashon de shik edo shitne ben banan hinchka Sisa zido to an ende na gistleda. O gwyndat bedishni di na khandal nishi. Eta holiado khajo etan sita kes. E yo eta ahino ne ado eta alhidinosen. Khashine la behes ani ilketaso da dinosen ado kon salado salatso da hon hit khatahno edo da dinosen khajobik etahno ado anna anleti ilchi atalthe ado hashino la enle chinyan khakhego abi gago apohne ankon tahla to o yugo khel ichille da chulla to tenne be khwe echo pa holno jo aje to tenne shi to la chinyan dinisen akho hashino la shi e at ende ho ikke tant il zoln le ho shito o keto le shito o konkin go hanno bitni aho wad na has chin dan lini ilchinen le kino ne bel yahajlo altskhoni yetel nelle dido na de no la yugo del chigo la hota na yi nilo ani hinde honit es twido sani hashine la dido le no betil shit ado oto pigata te onna na to alti no edo pa khwlyan shik edo shitne adon ta ayosnion hichiyanda ho waden na ta hacha benta alcholto beta alchol alskona hagam benao hast adossno alto ya at ado hashin soko yati ho waden na haso tran hit ne shik edo shitna ashkhode pik anol hon wadet nannish o khayui aho taik atalne tsil zaid alkhana hatzit o ahojlehende nannis tsot asani nitlini honit na khalchna hajo ben natanotkin hajo alkha antatle hashin tsoke analkele ya benne khaila altelno ado hajo bebeln taholne Ako oshi in yugo lato ben hit en hatotzi la nante shik edo shidne anihe naha nasla amado je enitleni amasan enale amayaje at nitleni nihin ha nasla hajo ben ta hinotkin anihe etanot ado anihe etanit beledi kakot ado ni hit so zendo Jego ben so ze nishi at anihe ol ilta holonde jo anihe ben hi yata ho ato be ben dan hit nestra it ot ya ba yi kanle of course se zero he nan hit ish ni do le aro din dal ne sheet a lunch and dan hit in dan hini ne ligi Jego dat en shik edo shidne trotatla ado chiyan ya at da sado huiche kon nihik nihik man hije nihik konta de kleon da holne slashi da don da holne do hajla iya huinzen amajla hojet amasanda ot hajla iya el nishinde no da hawa dan da holne Ja anst on nationis holje od alata on hinne endal I do kod kodo hasi do le do na he do na ani da nolleni hashin to go shi ya kebeda kehit besh bahasa an da nolleni ado chapter je ado trat le ke na so trani il ka di jato yego be nda hinot hin shik edo shidne Ako kun sago islado le do na he the nek be hasi nek hashkepel na halende do hashket da shik edo shidne na antkin ako ad banada that it alige ya our Navajo Nation Attorney General Ishi Kodosh and Lini Nihich Hanana Zito le do na he da sinul tsaigi Kwan sago ya sad lini ben hich hasido na he.
Thank you, Dr. Fowler. Good afternoon. My name is Doreen McPaul. Ki anin shlip ilagana bashishchi, honahni dashache ilagana dashanella chinli det nasha. I serve as the Navajo Nation Attorney General, and in that capacity, I oversee the Navajo Nation Department of Justice, and which includes the prosecutor's office. And the charge of the Department of Justice is to provide legal services to the Navajo Nation government. So we advise the 3 branches of government, all of the executive branch programs and divisions, as well as the 110 chapters. Currently, our prosecutor's office is working closely with Navajo PD, as well as the public defender's office and courts, and other criminal justice providers to maintain safety in communities. And the rest of our Department of Justice team is working closely with our clients and primarily with the Health Command Center to address the legalities of the current public health crisis. Issues that we've been addressing on in the past several weeks include issues relating to Navajo Nation authorities for the current public health crisis, and evaluating the authorities under the council, under the president's office, under Department of Public Safety, as well as the Commission on Emergency Management, and there's one more that I'm leaving off. Oh, Department of Health are primarily what we've been looking at lately. We've been looking at enforcement of the public health emergency orders as well as the executive order. We're looking at issues relating to the free exercise of religion under the Navajo Bill of Rights, issues specific to executive branch employees regarding compliance with executive orders and the public health emergency orders, as well as issues relating to liability and risk management. Our clients maintain the substantive expertise in all of these areas, and as lawyers, we are just trying to help them accomplish the needs, their legal needs to address the issues. And I did want to share that in approaching the legal issues, we are looking at those in light of Navajo fundamental law as described in Title I, including traditional law, customary law, natural law, and common law. And these principles are at times difficult to reconcile. But whether we're using traditional law or modern Navajo laws, what we're trying to do at the Department of Justice is ensure that the legal considerations and impediments are necessary to ensure that harmony is restored. So with respect to some of the specific legal issues we've been looking at, these are all related to the declaration of emergency, the executive order from the Office of the President, Vice President, the 3 public health emergency orders, as well as a 4th public health emergency order that's currently in draft form, but I can share some of the contents. And then President Nez also asked me to share some information related to donations. So first, the Navajo Department of Health has authority to create and enforce public health standards, and they can enforce these through Navajo Police Department as well as through NOSHA. And these requirements are necessary public health standards during this time and must be followed by all people and entities within the nation. These public health standards apply to all public gatherings, including Christian gatherings. And the nation is working cooperatively with government and private partners to seek voluntary compliance and cooperation, but can and will enforce these requirements against all businesses and entities, including schools, if they don't comply. And the public health standards also apply to visitors. Currently, visitors are not to enter the nation and can be excluded under Navajo law. Importantly, visitors don't include non-Indian residents of the nation, including doctors, teachers, doesn't include in-laws who are married to tribal members, and it does not include employees of any identified essential businesses. For Navajo Nation employees, there are specific requirements employees must follow as established by the President, by the Speaker, the Chief Justice, or the governance certified chapters. And the stay-at-home orders apply to employees whether you're on duty or not, and your employer can monitor whether you're abiding by these orders. And if you violate a stay-at-home order, you may be subject to discipline by your employer. With respect to donations, the Legislative Council passed on Friday, March 20th, and President signed into law on Thursday, the 26th, legislation that addresses donations to the Navajo Nation. It temporarily shortens the times and steps necessary for the nation to accept monetary or property donations, and it basically requires the president to approve the donation and for speaker to concur. And so we're working on an internal process to facilitate that, as well as a process to communicate externally to inform our enterprises, our community partners, our vendors, and any other individual or group that seeks to contribute directly to the Navajo Nation's COVID-19 response. So that will be forthcoming, and we'll share that on the Department of Health Command Center website. With respect to the public health order that's in current draft form, I will share that currently it implements a curfew for individuals. It also limits gatherings to no more than 5 people. For businesses, there are some additional requirements related to curbside or drive-through services with some exceptions, as well as, importantly, requires mandatory coordination with the Health Command Center. And I do want to emphasize that to avoid duplication of efforts or waste of resources, which has the potential to increase the risk of exposure of COVID-19, including the potential loss of life, to avoid all of that, all Navajo Nation governmental entities, as well as volunteer groups or businesses, are required to coordinate relief planning or other efforts through the Health Command Center, again, for the reasons that are identified there. And so this is currently in draft form, and I'll be heading over to the Health Command Center to finalize that at the direction of our public health experts. And so just in conclusion, I want to urge folks to stay home and stay safe. I want to urge our employees to comply with the public health emergency orders, as well as your employer directives. I want to encourage everyone to coordinate through the Health Command Center at every level, and to listen to our public health experts and adhere to their directives. I think, like everyone has said, that the overall goal here is the preservation of lives. Thank you. And next, I want to introduce Wilfred Davis.
Thank you, Attorney General. Good afternoon. Ado yate shikedo shidene adon hishkesht in etahuis ago koto hoditsa tsagahotzana ado nihinanta Navajo Nation President Honorable Jonathan Naz OPVP beditno bekedo satahagido Nikia Vice President Honorable Myron Lizer ta inishido ado teacher Ado ni trashin yadahot eto ni tratahojon Davis Filfred ishi in shiedo ishi shiji Kilichi ni dene nishlido bek edishne Ado tashchi bashischindo but anidashiche Todichi ni dashinal Executive Staff Assistant hot beshit itletgo kodo nashnish Ado nahan konste den nechen lahage aje betra dado ban tahage ado salat sodo ado so lecha hotzo hot nan nishigi chancellor ko di kwe large hanne do lehigi jo den ne benahaga ado den ne ba ado Aja to the Zenhane la Adalia no naidikidigi queba hashnet dolly. Lay hahol gij do hoste di kodo ne trasels ko ati ziligi latsa taho yol kalo to mo bis kan et ta o ha yish kago le de I ta ko etsaga ha zan zat asat api yagi ko etso de zan italia shinna ko do bisnashnes Rexley Jim do executive staff assistant hot I have a bit itlet na nish mas lahagi to dit nebza to de neba al aj to hot I yanaga ho dit saga ha zan bi yagi ita sin ado to de zan hot in hayila the net dan nahon lege net an nanel ande patoli khato ni ita to la pahanne da ti khone hit khakot a ene thail neta hot in sa keso ado de kuide shi to the zen hot italia ita ko Dite shina Rexley Jim jo hojon to na alkhashta ado hanne da shine la bahozen ado hol jishigi kwe hol jishigi bi di ziligi March 11th Wednesday akun di ta na konshikini lahage ni het khali ado ad isnaz pas ado thota stranda hodi ne do lake ta ando la bananas da hodi ne aden hitselsa zil beliadet in ne bidi ne do zil na ho zili ni hetzel da zili bidi no benish oski akwa kehet Raymond Jim Redhouse ol ya ko kwegi go ado na jita hanne higi do ni hen trato lesh no re na ha konsha age trohnle na ha konsto ado na yek eko to the zen age elia ko da yego ni hits an kede dot si no eko to the zen elia ita ado bis kana na kids at da ha yol kalko additional Raymond Jim Redhouse but ho one sin del do ho one mother the quishi sin del akwegi la bi yedo is in the hasnel a ko stanen long trobel jihigi jo age tro het lin long yanesta a ko ita o you the ne lasle not ani dan le do ado enne no seligi do ultra age betadet age da ultra do betzil ultra age banda an shigita ado na re pinian do na re loten zade ade ist da no und ist da hasnel ako yesige jo na ye eko ado nilchito ho di striba hashnegi den neben chiba age jo hot isnita hot en dat higi dat ado tro jo do troye no troje hat ado ni ade ye do hat ada nachne higi hat isle no ik eko etzil bagate yehigi jo ade dat zaz ade troch in lenege age ye lige age na hasne kut ade yen hika je ko doit ade ga gokta den net da tson le nahan le je kat a chine yaje ado no selle ado strisani don le naso bi des kanigi tson badoli no ko elia ishanshik den no lada khalet ba hint do na khat het do no na do kidigi kut kwegi ni hilche hona adoli ado the mona asli na re March 19 nats at da yos khaleta ita na re ho stodi tro khopwel hodje age do en khastri het khalin long shita be de shnedo ado alot ado kuigoshi Age hatral nast hatral ye jo hat at ya shin chige na hondalia age to yego hanege do to the zenige bilba hazen na kidigi test be na kid ado na rede kontil klebe yede ti kha do koni kango be yede test jo hot twiga da hosenigi do alia don hilch hot ko ben nachet so de zenigi yego so de zenigi hot nel do yilsa ko ko judicial branch bedi ne ko nehema Chief Justice ado biyado da inishigi peacemaking jo ado yaligi appe des go hot is twi da yoz kan kut elia sto ko hayu beti ahagi is twi san it's kgk sto de ya lasle do lato benach hot kut za na ho jishigi to mo yajo na tin lao yo khale ta kwe sebenaga ho zaneki na reje museum ta hoti ne piche ta kwe ho na mazasa kwe gi na kie beti neneki jo ajasenel na di nel do at opa haya hat da jo hot ho jishigi shin da za atil no bigijin hol jishi ben na kwe ni nel ko tselke ni na rahagi do ba khegi kwe Eric Willie Hulia do hot yaha to the zen na ye to the zen a stwi hade she akut hits ado hot ado to the zen sen khanne dat hegi bahni yado ba his zendigi egen kha ila ako ita akwegi yata nota ligi khele yata nota no akwegi panetado na reti is cards hotel zen yedo belist hodet nenegi kut ishla dot nedego aje khadeskis kut ko shik shit no senegi ado to yugoshi akwete de jato ado khadetin be so hotel zen na tashke in the ta zu jo hot be khatsodilzen no jo hot at eben yeholjish ado sen dat do be hilkhati ja do be lati le nenegi do benda hot aba hanne ko jeda shin hot alia ko na reso leje kha hot zogi ajhini tlahagi na re so tsedenez nothing do ba within the state of Utah, so let's that so be yiki hunza at benst no ado San Juan County di nenegi be yedo na ki at kut benst do betol na no de bahanne ko ahlanet that la do dik at na kis kan the mo na kitchenagon do is kanda nisho Tuesday and Thursday na range hil na KTNN biyeto ado ati khoto shin sto nadet la do lishik de na no senegi ko be khilta hosne do ado ta isolts ado getithin alkehol en yehegi do do ashon be dan not ko din rege website la NDOH be website digi Department of Health be no accord hayut sanago naidikito saide ba naidikit na hallen accord dige naidikidigi sagit you naidikidigi to kunda bakha ajutan no do de no trado be hilta hosne kut ko shik de no slenigi nana di Tuesday and Thursday as time that has cans go kut ba na hanne isha ado di kudo town hall meeting eliagi do do kun nana nchil ne bigis do na card kut nada is not do lesen hisnen hinant lenigi kudo ado ne hilla thata kisto ado yo nak na hoch do negon that ado yo na hoch do ado yo ze na hoch do nja yota ne ado betel ne hajo senta nenigi joid ne big hanil ego ebik attitude le kut koshik shit in no senegi ado nada zedo ne mado ne je ne che ne masan ne nale bich nada alye bich na holjish jo ba haya koko al sah nenegi da kut ashe ahat da she na iliago yat eto li hunso de sa de geshido kodo be iga ni yado lato e hot ai be yiz to li to na na he hunso do li